There is no such thing as a routine problem. Every disease is unique and each person is unique, and we never take for granted the trust that a patient puts in us to put their lives in our hands. This hospital is routinely ranked as the #1 hospital in the United States. It's not any one individual person or any one individual department that makes it considered the best in the United States.
125 years ago, Mr. Johns Hopkins had a vision. By linking a hospital and a medical school in a previously unimagined way, he sought to inspire collaboration that would revolutionize medicine. From the teaching of medical students beside patients' beds to the placement of diagnostic labs adjacent to the clinics, Johns Hopkins' pioneering physicians would set standards that would make it a model of its kind for the nation and beyond. Over time, we've built on that tradition of combining patient care, research, and education. All this has led to stunning breakthroughs in diagnosis, treatment, management, safety, and prevention. In the last 25 years alone, our achievements have included advances like the nerve-sparing prostatectomy, a chemotherapy-laced implantable wafer for the treatment of brain cancer, multi-patient kidney swaps, and a double-hand transplant, along with breakthrough genetic and stem cell discoveries. Our deep understanding about the complexity of diseases and genomics has had a profound impact on the way we practice and teach medicine. Rather than dwelling exclusively on disease and the anatomy of illness, we are more attuned than ever to each patient's unique situation and needs, patient-focused care, in and out of the hospital. From the outset, William Osler, the first physician-in-chief of Johns Hopkins Hospital, understood the importance of this concept. Care more particularly for the individual patient than for the special features of the disease, he said. In response to that need for customized care, we've created systems and technologies to pool knowledge through multidisciplinary care teams and programs that support our patients after they leave the hospital and at home. We've also implemented electronic medical records to make it easier to share medical information across our care teams and directly with our patients. Over time, Johns Hopkins leaders recognized that the sheer size of our institution and continuous rapid growth made it difficult to practice a unified approach to patient care. A major change in governance resulted that united the hospital, the School of Medicine, and the expanding health system into what is known today around the world as Johns Hopkins Medicine. Within this new structure, our institution now responds better, and with an integrated approach to opportunities and challenges in our marketplace. It has provided us with stronger and more cohesive positioning to extend the vision of Mr. Hopkins and the early trustees. It has enabled us to take our expertise and discoveries beyond the walls of the Johns Hopkins Hospital and School of Medicine, into the community, the region, our nation, and the world. The past quarter century has also required tremendous physical change to our facilities and campus. Expansion to keep pace with technology and to meet the needs of growing patient populations resulted in a near doubling in size of Johns Hopkins East Baltimore location. Most importantly, through forward-thinking design, we are providing care that is not just convenient and cost-effective, but also comforting and healing within the hospital and in our community settings. Through innovative, insightful leadership and with enhanced physical capacity, the Johns Hopkins Hospital has continued to reinvent itself. Drawing on decades of experience and lessons learned, we have, over the past 25 years, intensified efforts to ensure the highest quality and safety in our patient care at the Johns Hopkins Hospital and in hospitals and healthcare settings everywhere. The tragic death of pediatric patient Josie King led our persistent efforts to eliminate preventable harm and to the creation of the Armstrong Institute for Patient Safety and Quality. This work is now emulated all over the world. Throughout our 125 years, we have continually asked ourselves, what do we stand for, and how can we be better? We have sought to become an extension of the people we serve here at home and those around the nation and the world. That diversity enriches and empowers us. It provides the insight and empathy necessary to respond to the monumental changes and challenges ahead. There are many indicators of success, but the real measure ultimately is our patients' well-being. Nowhere on earth is medicine being practiced as it is at the Johns Hopkins Hospital. we are bound together through deep history, timeless commitment, and our pursuit of excellence to provide hope and inspiration in our care for one another, for our patients and families, and for the world. With this rich history as our foundation, we look forward to another 125 years of delivering the promise of medicine.